Every brain gives people the capacity for language, moral judgments, and rational thought. It's responsible for each individual's memories, movements, personality, and how he or she sees the world. Multitudes of people are affected by diseases and difficulties within the brain each and every day. These difficulties can come in forms such as a brain tumor, cancers, and aneurysms. There are many different forms of treatments and cures for brain damaged patients that have evolved and advanced through technology to help save many lives suffering from brain complications. In 1879, William Macewen was considered to be the first person to successfully remove a brain tumor from a young woman's brain. His success led to many doctors to attempt brain surgeries with different technologies being invented at the time. Although, due to the little knowledge and lack of technological advancements, those inventions were only accurate in obscure cases. But today, our society has come together to master the complexity of the human brain. The real question is, how do you know you have a brain tumor? Due to the most common symptom of a headache, some don't realize how severe their headache could be. The signs and symptoms of brain tumors vary greatly and depend on the brain tumor's size, location, and rate of growth. General signs and symptoms caused by brain tumors may include the change in pattern of headaches, which are worse when you are laying down, unexplained nausea or vomiting, vision problems, seizures, and gradual loss of some motor skills.
There are a plentiful amount of different tumors, all of which come in different shapes and sizes within the brain. These tumor types include gliomas, which are made up of neuroglial cells, the cells that provide protection and support for the brain cells. Astrocytic tumors, which are low-grade in children and high-grade in adults, account for the largest amount of glioma tumors. There are also primary tumors such as tumors of the pituitary and pineal glands, lymphoma arising in the brain, vascular tumors, and melanoma. Tumors are made up of two different parts: the parenchyma cells, which are the actual malignant cells, and the stroma, which is a strong connective tissue that provides nutrition to the tumor. The membrane of a tumor does not have much security. It is very porous, which means that many different things can pass through very easily because there is nothing stopping it from getting in. Unlike normal cell tissue, tumor tissue is thin and multiplies very rapidly from mutated cells. Tumors proliferate or divide themselves very rapidly, and that's where most of the mutations come from because there is no time to check for mistakes.
Before any surgery can be performed, a tumor must be located in the brain using imaging machines. Throughout the last 20 years, MRI or magnetic resonance imaging and CT computer tomography scanners have been improved to gain a better image of tumor size and shape. MRI scanners use magnets to take a non-invasive scan of the body. Gold and Edmonds state that an MRI scan is the best way to see inside the human body without cutting it open. CT scans use a circular X-ray machine commonly known as the donut. A bed slides through the X-ray machine and slices of a three-dimensional picture appear on screen for the doctor to begin examining. One of the more popular surgeries being done to remove brain tumors is known as stereotactic surgery. Stereotactic surgery is known as the precise localization of specific tissue, and in this case it focuses on locating the unhealthy brain tissue and removing it. Stereotactic surgery is less invasive than an open brain surgery because it does not require opening the skull. First, the surgeon adjusts the frame to fit the size of the patient's skull. Attached to this frame are CT indicator panels that show the surgeon his area of operation in the brain. The frame also carries a probe holder that can be adjusted to reach the proper area of the brain. Once the probe holder is in the correct place, the surgeon then drills through the skull and goes into the brain through the small hole. A major aspect of this technology, known as the Minerva system, is to cut down surgery time from 2 hours to 30 minutes. Dr. Tribole and Dr. Frankhauser, who are neurosurgeons, worked together to create the Minerva system. Their goal with this new system was to create a robot that was required to carry out in an autonomous manner the following procedures: skin incision, drilling of the cranium, perforating of meninges, and manipulation of stereotactic instruments. Another complication that can occur within the brain is called an aneurysm. These are a bulging of an artery located in the brain and are harmful because if they burst, they cause bleeding in the brain. Two types of treatments for this include the clipping technique and the coiling technique. For the aneurysm clipping, a neurosurgeon uses a specialized microscope with live imaging feeds to maneuver through the brain and locate the aneurysm. Once at the site of the aneurysm, a surgical clip is then placed at the opening of it as shown here. This prevents further blood flow and decreases the risk of a burst.
It is the same objective for the coiling procedure, but a different approach is used. In this surgery, a microcatheter is guided through the blood vessels to reach the aneurysm. The catheter then releases a coil, filling the aneurysm. This is supported by a stent so that the vessel doesn't collapse. As shown here, there is a catheter placing a stent in the blood vessel, and there is a catheter now placing the coil inside the aneurysm. As you can see, this obstruction by the coil blocks off blood flow into the bulge. Again, endovascular coiling and clipping are two different ways in which brain aneurysms are treated. Brain surgery, throughout the years, has made many advances with the benefits of increasing technology. Doctors have looked at previously used operations to help them expand their knowledge and develop into better and safer procedures. Specifically, brain surgeries on tumors have been subject to many progressions. Different types of technology have been used to remove various sorts of brain tumors. These require many processes, including locating and extracting to complete the excision. Along with brain tumors, other issues in the brain have required surgery to cure. These involve a variety of surgeries such as clipping and coiling of aneurysms, stereotactic surgery, and certain types of radiation. Though operating on the brain can be risky and complex, these advancements have proved to be successful in benefiting the patient at stake, resulting in safer procedures.